Senegal HIV care drops 25% as anti-LGBTQ arrests drive patients away from treatment centers. Government data reviewed by Reuters shows that visits to HIV treatment centers fell from 2,400 in January to about 1,800 in February, and over a 25% drop. Officials say fear of arrest and harassment is keeping patients away from life-saving antiretroviral drugs, which treat and suppress HIV. The decline follows new legislation introduced last month that doubles prison terms for same-sex sexual acts to 10 years and increases fines to about $18,000. Since early February, at least 86 people have been arrested, including 18 in a single April 19th raid in Linguere. According to the National Council for Fight Against AIDS, or the CNLS, follow-up interviews found men who have had sex with men were avoiding clinics out of fear of being identified, arrested, or abused. Dr. Thiam, a former health minister and executive director of the National Council for the Fight Against AIDS, warned, quote, "We certainly fear, and this has been confirmed, that this wave of arrests will have repercussions for our work," end quote. The impact could be significant. UNAIDS reports the new HIV infections in Senegal have risen 36% between 2010 and 2024. Health experts warn that treatment interruptions increase transmission risk. The World Health Organization has urged countries to remove punitive laws and reduce stigma, cautioning that such policies can fuel HIV outbreaks. You know, when I first read this story, I was kind of like, what? You know, and it makes sense, but I guess part of this, you know, when we look back at history between the late 80s and 90s, and it was called GRID, and it was, you know, it was attributed to the gay population.
Right, it was gay related.
Worldwide views, it's not just the gay population now. The heterosexual communities are actually increasing the numbers while the LGBTQ numbers are decreasing, we're seeing.
Well, I have questions.
Yeah.
First is, what about HIV transmission to women?
Right.
I mean, do they not care about women? And doesn't Senegal want to prevent that by safely and respectfully treating everyone, including men, who have sex with men and women?
Right.
I mean, you're just opening this up to a huge swath of
Talk
people.
about stigma.
And this is so appropriate. Today I had lunch with someone who I went to Kenya with. We were there for a long time. And most HIVs are the straight population.
Right.
So it's a boogeyman kind of a concept.
Right. Right.